Okay. I think we're going to go ahead and get started here then. Um, Once again, thanks everyone for joining this series. It's been a real joy to see so many of you consistently, as well as those who have only been able to join a few times. I know it's tricky with schedules and everything to carve out time to join these, but appreciate you all joining. And I think it's been a really good it's definitely been a good experience for us, and I hope it's been a good experience for you as well. Um, so today's the last session of the series. We're just going to wrap up some things, try to um, determine some outcomes, and try to wrap everything up and get things done nicely here. Um, so as we roll through, um, I dropped this link in the chat if you were here. If you were not, it may not have gone through, but there's this QR code. Um, it'll just be a quick post survey. We would ask that you take a few minutes and fill this out. We'll have the QR code on as well at the end. So if you don't have a chance to do that now, you can do it later, but we will take maybe a couple minutes here on this slide, let you scan in if you'd like. So we'll pause here for maybe 2 minutes, and if you want to pull that up. All right, I think we're gonna go ahead and move past this slide. But again, if you didn't get a chance to get to the survey, we'll have the QR code and link again at the end, or we can send that out to you. But I think we're gonna go ahead and get started. So I'm gonna take the first part of this presentation, and then Casey's gonna take the last part and wrap it up. But first of all, I just wanted to review the series really quickly. So we talked at the beginning, we had a little definition that we use to define health equity from the beginning. It's from the CDC. It says health equity is the state in which everyone has a fair and just opportunity to attain their highest level of health. So in this series, we've tried to cover areas where there are opportunities for us to help others reach the highest level of health. We've covered the first session was just an introduction. It's where we got this definition from. We talked about what health equity is, what it looks like, what your experience in your communities. Then we went through how to read and interpret data related to health equity. We had that with Deepany from the Department of Health and Human Services. We had equitable care for people with disabilities with Rachel from the University, Utah State University. We had our community health workers panel and talked about how they are working to fill in the gaps of care where there are opportunities for relationship building there. And we had Daniel Chipping from Western Governors University talk about value-based care and the future of healthcare. So we've covered the scope. We've gone through a lot of different things. One of the questions on the survey that you'll have an option to go over is, where did we fall short? And it's something that from the beginning, we mentioned we weren't going to be able to cover everything in 6 weeks. And health equity is something that is going to be continually evolving and changing. So addressing health equity is not just a matter of finding solutions for now, but it's continuing to evolve and to find solutions for the future. So one of the areas that came to my mind was we didn't have any sessions on some of the sort of hot button topics that have been prevalent in coverage the last few years. So racial inequity, sexual inequity, relating to sexual orientation, just some of those things that have been covered. And it's sort of, on the one hand, there's so much coverage and so much attention on it right now that going over it in this series felt like there were other areas that we could cover to sort of give light to other areas that need some attention. So on the one hand, we know there's a lot of attention and a lot of resources dedicated to those areas. And so we figured we could cover the other things. But on the other hand, there's a reason that they're so prevalent. And so, of course, it's sort of a double-edged sword. So that's one area where if we had more time, more sessions, where we would have liked to have had more coverage, but we just didn't have the capacity to do that at this time. So sort of a tricky situation there. You'll have an opportunity to go over that with your review, your session survey on other areas where we fell short and other areas where we can improve in the future. But that's just a quick review of what we've gone over. And so some key takeaways, these were sort of my key takeaways from the series, as someone who's been able to moderate these sessions and been able to listen to your feedback and gain some perspective. The key takeaways that came to my mind were that inequity is not limited to one part of the state or one contingent of people. It's something that is affecting everyone and affecting every area of the state. Some statistics from our attendance, we've had 85 unique attendees. So we've had 85 people attend at least one session, and they've all come from just a huge variety of backgrounds. So people of all races, genders, sexual orientations, backgrounds, people who are from Utah and who have never left, people who come from an international perspective. Oh, it's been really interesting to see that. And we've had attendees who cover every county in the state. And I'll put a little, I guess it's not really an asterisk, but of course, it would be tricky to have providers who live in every county in the state, because some of them are so rural and small, and some of them don't even have those resources. But we've had someone who has those counties in their service area. So that's been really great to see. We've had a wide variety of backgrounds there. So that's given us a good opportunity to find out what's happening, not just in our little bubble of the state, but all across the state. And we've had people from national entities as well. So it's been a really great opportunity to find out what's happening, not just in southern Utah, not just in the Wasatch Front, not just in Cache County or some of these more heavily populated areas, but to find out what's happening all over the state. So that was a huge takeaway for me. And there's a wide variety of things that people are doing. Like I mentioned, wide variety of professional backgrounds. We've had hospital administrators, we've had people who had their own clinics and private practices, we've had public health specialists, we've had pre-health students, we've had a wide variety of health professionals. So it's just been a really cool thing to see everyone come together and have their own experiences and bring that to the table. And then the other takeaway, and this is, I think, the more obvious of the two takeaways that I had, but there's a desire to achieve equity. And mentioned it on the previous slide, equity is something that will continue to evolve, and it's not something that will ever be firmly solved, but it is something that we can continually work on. And it's a great thing to see that people have a desire to see that happen. Another statistic for attendance, we've had 198 hours of training completed in just this series. And so in the 5 previous sessions that we've had, that adds up to 198 hours based on our attendance. So that's been great. And I've just really appreciated the feedback we've received from you, both during sessions and between sessions. I've loved getting your emails, your comments. It's been really great to see. I've really enjoyed just getting to know you, getting to interact with you. So it's been a huge pleasure. But really quick, I think this is a chance, and this is a question that's on the survey. But we would love it if we had a minute to discuss some of the key takeaways from the series that you've had. So if anyone wants to contribute to that discussion, you're welcome to unmute and do it that way, or you can drop it in the chat, but we'll take a minute here to discuss some of those key takeaways. Not a very chatty bunch today. That's okay. I've sort of felt that as well. Just sort of today, it feels like we're coming to the end, and that's okay. So there is a part in the survey where you can talk about key takeaways. I'd ask that you'd fill that out, but it's okay if we're not feeling particularly chatty at the moment. But just one thing we wanted to put a plug in for is our health resource database. We've developed this on our Rural Health Association of Utah webpage. It was part of the same grant that provided us the opportunity to put on this series. And it's a way that we can start working towards some form of equity. It's not perfect and it's not complete, but it is something that we believe is helpful to people that have access to the internet, that they can go on and find resources in their area, in their county. So really quick, I'm going to stop sharing the presentation and start sharing a screen here. So you just got the Rural Health Association of Utah page. On this left side here, there's the health resource database. Click on that. And then one thing we would ask that you all do is go on and find your entity. So find the clinic, hospital, public health department that you work for, and make sure that it's on here. If it's not, click on this report a resource tab. It'll take you to a form where you can fill in the resource and get that added to the page, which is really important because we want to make sure we've got good broad coverage of everything. So we will really quickly, I'm going to stop sharing so I can get back to the page. It's annoying that it's got that drop down bar there, isn't it? But you can go to your county and find different resources. So for example, we'll go to Iron County. It'll show everything, every resource. And then there are different categories that people can go into as well. So we've got all of these different categories that people can look for. And we've tried to have a pretty broad definition of health. You know, we know that there are lots of contributing factors to health. So like you can see, there's education resources here. There's libraries, legal resources, recreation, things that maybe aren't narrowed in on in health, but we've got this broad definition where people can find resources that contribute to their overall health. So you can narrow it down and find resources that are helpful there. So something that we are really happy with, something that we are really excited to continue developing, something we hope that you will all contribute to as well if your resource is not listed there. So please go on and you know, play around with the database, and we'll get you added if it's not there. But that's just one thing that you know, we can work towards and get people an opportunity to find out what's in their area. And then I'll give the rest of the time to Casey.
Thank you, Austin. We want to talk a little bit about now next steps. We've reached the point of the end of the session here, the Echo series that we've done. You know, we've been able to discuss some great information, and, you know, brainstorm together and talk about some of the gaps, but what do we do next? And I want to pose a couple of questions for you and a couple of asks. Since you stuck it out with us through 6 weeks or 12 weeks and 6 sessions, a few things that you can do for us and that we can do for you to help start to address more of these equity issues that we've identified. But one thing I want to pose to begin is I want each of you to think of one thing you can do within the next month within your organization or your community that would help address an inequity. So we're looking for those low-hanging fruits, but what's one thing you can do within your organization or community that can help make even a small difference towards resolving some of these barriers and creating more health and equity throughout rural Utah? And I want to open the floor to see if there's anybody who wants to share an idea. I think if we can share some ideas here, it would definitely help maybe get the creative juices flowing for everybody to think and reflect on what's one thing that each of us could do. And there are 25 of us on the call. So if each one of us finds one small thing that we can do in the next month, that's going to make a pretty big difference across the state. Go ahead, Camille.
Hello, everyone. My name is Camille Treparis. I work for the University of Utah as a health equity consultant. One thing that I find really beneficial is connecting communities. I've worked with a lot of you in your local health departments and have visited with you in person. So hearing about your communities, even seeing your communities, have really helped me to understand how I can take part in sharing that information with policymakers, with funders, and with the community health workers, as I am a community health worker myself, and understanding what resources are needed and maybe how we can help one another. Thank you.
Thank you. And Carlos, I saw you turned on your camera. Did you want to share something?
Yeah, I was gonna say, I think one of the things that I can see that Holy Cross Ministries, which by the way, I work at Holy Cross Ministries, I'm the health outreach manager here, is just to get Holy Cross Ministries enrolled in this page, the Rural Health Association of Utah, because I was taking a look at it and it doesn't look like we're in there. And that's for sure one of my big priorities for my department, which is the health outreach, but also for Holy Cross Ministries as an agency, to be more involved in the rural areas. It's really hard
Mhm.
for me to say that word, but yeah, to be more involved in those areas.
Mhm. And that's actually on my list of next steps, but I will say, if your organization's not listed, if you're not in one of the 24 rural and frontier counties, we do have a statewide page. So if you're in Salt Lake or Utah County, Davis County, any of those urban designated counties, but you have resources that are available across the state, we do have that statewide page where we can get you listed there. So, Carlos kind of stole my thunder. That's one of the next things I want to talk about after we kind of brainstorm a little bit is making sure that all of you go on, check for your organizations and your resources on the RAO.org Health Equity Database. Austin showed that there's a tab at the top to report a resource. And if you guys can report anything that's missing, we'd love to get it added to the database. Camille, I saw you raised your hand again. Did you have something else you wanted to add? So anybody else? The next thing I had on there was, let's see, Achel? Am I saying that right?
Almost. So one of the things that we've done at Tri-County Health is we saw that we could partner with the local libraries to get in blood pressure cuffs for people to check out if they have some kind of issue or their doctor is ordering them to monitor their blood pressure. So we have been working with them to actually get blood pressure cuffs into their facility to be able to check out to people whenever they need to. And then we've also partnered with them to get out information on our diabetes classes, our teen outreach classes. They have been a great resource. So I highly recommend anybody that needs a partner to get information out. The local libraries are incredible.
That's awesome. And if you can make sure that information gets reported in our database, if it's not already available, we'd love to list that for you as well. But it's a great point. The local libraries are definitely a great place to connect with certain populations within the community. I'm loving these ideas. Is there anybody else that has any additional ideas they'd like to share? And you can just go ahead and unmute and speak if you have any other ideas you want to share. And feel free to interrupt me at any point as well. But the next point I had on there was very similar. If not you individually, what about your organization? Are there things that your organization can do that maybe are hard to do individually that you could accomplish within the next month within your community, or even something within your organization? And I want you guys to think through these things, and then as we mentioned, make sure that you look on RAO.org under the Health Equity Database and make sure any resources you're aware of are listed. We have put a lot of work in with our interns and our staff, just scouring for resources, but it's very difficult to capture all of them. And so we would love to have your help if you can go in and take a look and see if all the resources you're aware of are listed, and then report anything that's missing. And we can get those added in for you. We get those added pretty quickly, usually within a week. Yeah, thank you, Megan. Yeah, the more we get resources listed, the better, the more information we can get out there. And then this last question, I know we've talked about this at points, but Austin and I work with the Rural Health Association of Utah, which is a professional organization that supports healthcare throughout the 24 rural and frontier counties in Utah. And so we do have some resources and some connections with RAO and the ability to seek out new resources. So we wanted to take a minute to speak with you guys a little bit about what are some resources or supports or activities that you feel like RAO could offer in your community that would make a difference for resolving barriers and equity. And this is an area where I will say, feel free to dream. It may be too big for us to accomplish right off the bat, but we definitely like to hear from all of you, especially those that live and participate in rural communities as our constituents for the Rural Health Association of Utah. what are some of the things that we could do that would make a big difference in your community? So ways that we can work with you and support your organizations or other organizations in your communities who are really working to create better health equity. And feel free just to unmute and share any ideas that you have. Really hoping, whether it be in the session today or via email after, that we can get some feedback from the group on some things that we could be directing our efforts towards as we're kind of wrapping up this program and looking for next steps on our end.
Yeah, for us, it would be, I mean, because believe it or not, we're, like I said, we want to get out there in those communities. But for me, it's because it's so far away from Salt Lake, you know, that for me, I don't even know, like, and I'm sure, you know, the biggest, like, what are the biggest needs that people are facing out there? You know, like I hear from, because we get cases here and there from people that live in those communities, but we don't really get a lot of people, maybe because we don't know that we're available and we could do, we can do services like over the phone or Zoom or whatever. But I don't really know like what the big needs are out there for people.
So like a needs assessment type activity, Carlos,
Yeah.
to really identify those.
Yeah, along those that same line, I think understanding what kind of funding is available for rural initiatives would be helpful too. Thank you.
I think that's a great point. We've, I think, considered monitoring grants and listing them on our database is kind of tough, but I think we could do more as an organization to send out funding opportunities to resolve issues. But I'd love to kind of partner those two together and be able to do some needs assessment and gather some information. I'd love to hear what people have already done. I love to work together and not have to recreate efforts. So if anybody's done any needs assessments around health equity, I know there are several other organizations that have been awarded funds similar to what we were awarded to run this Echo series. But if there's anybody out there that's done data collection for equity through those funds awarded through the Office of Primary Care and Rural Health, we'd love to connect, take a look at what some of those outcomes were and understand what areas still need to be assessed, and then be able to go out and search for grant opportunities and funding opportunities that would address some of those areas and get those out to our community partners. That's definitely something we could take on as an association.
Casey, this is Amy Contreras. I'm the Chief Nursing Officer in Milford, Milford Memorial Hospital. So being a federally monitored critical access hospital, we don't even do, we're not required to do a community health assessment. So I don't think you guys are getting any of the information from any of these critical access hospitals. Maybe you are, I don't know. Like I'm thinking about Kane County, Milford, Beaver, why can't I think of it? So I don't know. Nephi may do one. Gunnison. I don't know how much information that those guys are having to submit, but I know Milford and Beaver does not have to submit that. So you're not ever getting that information from us.
Yeah, Amy, you guys are a rural health clinic.
No, we're a rural health hospital.
Milford's hospital is, but they designated all three of the clinics associated as rural health clinics.
Yes, correct.
So as a rural health clinic, you don't report any kind of quality data because you're exempt from the MIPS and the quality data. But I can check in on that, Amy. Our board president right now is Greg Rosenthal, who runs the Rural 9 Hospital Association.
Perfect.
So I can check in with him on what kind of data that has been collected from the hospitals themselves. And then we're actually working on getting a similar group started for the rural health clinics themselves. So I'll actually be in contact with your clinic manager pretty shortly about some visits for that. And that's one of the things that we're looking at with that group is, would it be beneficial for the clinics like Milford Clinic, Beaver Clinic, Pearland Clinic to report some basic quality data just to see kind of where you measure up against the other rural health clinics in the state and give you kind of a baseline metric?
Right, so just to clarify, I am the hospital, not
Oh,
associated.
you're the
I'm
hospital,
the
you're not the
hospital.
clinic, okay.
That's okay, no
Yeah.
big deal, but we work very closely with them.
Yeah.
But I know like our biggest need is like transportation. You know,
Mhm.
when we were on these calls a few weeks ago, it was, oh, well, we've got Uber this and we've got, you know, and I'm aware of all those fantastic opportunities in the city, but here it's
They don't
like, if you
exist
don't have a
in
neighbor
Lincoln.
to take you, you're not going to your
Right.
consultation. So the nice thing about COVID, and I had mentioned this before, was the telemed thing. We really advanced significantly in that realm, but and I'm hoping that it doesn't fall off the radar. The
Yeah,
telemed piece.
we're watching pretty anxiously to see where that lands long term as well with the what was expanded for telehealth through the pandemic. So that is an issue that we have seen come up specifically in Beaver County. Amy, we've worked a little bit with family health care on some transportation programs around substance use disorder, but that's definitely an area we can continue to try to look at. And I'd love to hear ideas from around the state as well on kind of any programs that have been put into place around transportation that have been effective. I know that Milford's not unique in that issue. There's a lot of rural communities that face very similar challenges, and I'm not sure we've come up with an effective solution for that just yet. There's High Valley Transit. There's a good example in the chat. Oh, bus routes. Okay, yeah.
Well,
And
they
this
wrote a
is
grant
inclusive.
with the local health department and other partners to provide transportation. And I know they were partnering with Tooele as well and starting an initiative there.
That's awesome. I'll have to note that down and take a look deeper at that. That's something that Amy, if you want to connect with me offline, I'm part of the transportation board for the 5 counties region, and they're always looking for opportunities to expand services around that. So that might be something we might be able to work together on.
Perfect, I'll do that.
Yeah. Great. And then also let's make sure that that link gets captured in the notes for the messaging. So we can go back to that. What else? The transportation is definitely a big area to work on. Is there other equity areas that you're seeing that are prevalent that our association could offer some support for? Housing, that's a big one. Yeah, that's a tough one. That's a big project. Definitely an area we can take a look into. I'm not sure right off the top of my head what resources we'd have for that, but it's definitely something we can help with.
Well, there's a $10 million coming down the pike from the governor's office, and the money has to be controlled by government agencies, county and city. So it really calls for a coalition to be built.
Yeah, we've done a lot of coalition building through our associations. That's something, if you've got more information for that, you could send me on that 10 million. We'd love to take a look at that as well. And then Robert?
Yeah. So I'm with Community Health Centers, and we're our administration's in West Valley, but we have clinics up in Tremont and Brigham City, and some of our most of our clinics are located on the west side of Salt Lake and extend west, so we do get some rural activity there. But I would really be interested in any successes people have had with maybe contracting out different physician services. We have an opportunity that's come our way. A hospital in Logan has announced that they are stopping all obstetric service, all baby deliveries, all OBGYN activity. And we're not really up that way, but we're trying to decide, because there are physicians still there, they're just not going to be able to practice women's health care. And I'm wondering if anyone has ideas of how to best approach that scenario. I mean, we're looking at, do we hire, one of those OBGYNs up there, one of our physicians, or do subcontract, or we're just trying to figure the best way to handle that, both Logan urban, but also rural surrounding communities, to provide women's health up in that area since it's going away.
Anybody from the group is welcome to jump in and offer any thoughts on Robert's situation. Robert, my email is going to come up in a couple of slides. If you want to email me more about that situation, I can dig in a little bit more. I don't know off the top of my head, but I'm happy to dig into that a little bit more for you and see who I can connect you with.
Yeah, thanks. I realize it's kind of an unusual issue that's come up, and well, maybe not that unusual.
We're happy to dig in more, and I will say that I want to dream big here and talk about big picture issues. May not have the answers right now, but I'm happy to connect any of you with any resources or organizations that we know of and see what we can do as an association to support as well.
Yeah, no, that's great. Thank you.
So yeah, if you can email me those details, my email's just a couple slides away, but and I'll send that invitation out for anybody else on the call as well. If you want to connect with me or Austin on some of the issues you're seeing offline, or provide resources that you want to get out there, any of those kinds of things. That one of the things that we focus on as an association is trying to build partnerships and collaboration. So we put a lot of effort into connecting resources that are available with people who are needing the resources, because that's often a difficult thing. Carlos has alluded to that. He's got a resource that's available statewide, but people may not necessarily know about that. So we're always happy to kind of build those relationships, make those connections. We like to see those connections happen to augment everybody's efforts, and try to give everybody an opportunity to raise up what they're doing a little bit higher. And then obviously we also spend a lot of time looking for grant funds and projects to fill in gaps that are in the communities where there are no resources as well. So that's kind of what we do as a focus for our organization, is supporting the working healthcare workforce in Utah and providing resources and education and connecting people to try to make sure that the sum of all of our efforts is maximized. So what else? Kind of parting thoughts as we kind of move towards the end of the hour. What other resources or areas do we need to address in rural Utah to really reduce the inequities that we're seeing, that we've identified? And this may or may not be something our association can help with, but I want to spend a few minutes here as we wrap up, just kind of brainstorming those things so that we can report back some of those thoughts to the State Office of Primary Care and Rural Health, and get those things on everybody's radars. We've identified housing, transportation issues. We've identified some challenges with data that's available, but what are some other areas that you're aware of that we really need to look for resources or look for programs to address?
I was listening to a podcast today where they talked about representation in your provider provides better health outcomes. So I think that's on my radar for improving health equity.
Can you elaborate a little bit more, just so we're fully
Sure.
understand?
So I can actually, I shared it on my social media, so I can share with you as well. That during COVID-19, there was a lack of trust amongst the community. And in order to address that, they utilized community health workers to kind of explain and support the public health findings and statistics, providing vaccinations and testing. And so this Dr. Michelle Evans was the primary investigator of the health equity of COVID-19 research. And so her report provides the scope of when communities had somebody who represented them to address their health issues, they had better outcomes. And we know that when you have the trust of the community, it kind of helps with that access issue. It helps with the follow-up and implementation of care. So they understand how to navigate systems. And so that diverse representation is very relative to providing health equity.
So our office, we're also an area health education center, and we work on recruiting youth out of communities to get them into healthcare and try to get them back into those communities. So that's a long-term goal we've been working on. But I know community health workers is an area we've been working on recently, and we've been looking for ways to try to increase the supply or the funding and availability for community health workers to get into those communities for that reason as well. Definitely CHWs are a big piece of what we want to help move forward in Utah and make more prevalent, because they make a huge difference. We've got a couple that we staff out of Richfield that could tell some stories, just how much of an impact they've been able to have. It's been huge. Yeah, that representation in the healthcare workforce is something that's kind of ingrained in what we've been doing for the past couple decades as a center. Other thoughts? And we don't have to keep you guys for long. We want to make sure you have a few minutes here at the end if you haven't completed the post survey to complete that for us. And then our contact information is listed on the last slide as well, so that you're able to reach out to us after the session if you have questions. And I think Austin will probably email that out as well. Carlos, see you unmuted.
I was going to ask you, so you guys said that this is the last meeting that we're going to have? Is that?
This is the last session in the series.
Oh, okay. Well, just keep me in the loop if you guys ever do more meetings like this, because they're really useful. Yeah. Yeah,
we're gonna continue. We've got a few other series that we're gonna try to produce through our equity or through our Project Echo Hub here at the Rural Health Association of Utah. And I would encourage all of you, if you're not already members of the Rural Health Association of Utah, you can find the information on ROW.org. We hold an annual conference each fall in St. George. The conference is scheduled for November 9th in St. George this year. We'd love to have all of you join, and we've been trying to focus on equity in those conferences as well. Mark?
Yeah, Casey, thanks again. I apologize I wasn't able to participate in as many of these as I hoped to, but I just wanted to just do a real quick PSA about we have a new interprofessional mobile health wellness van that we're going to be starting here at Southern Utah University. The goal of the project is going to work with interprofessional undergraduate students here at SUU to go out and do outreach into rural communities and vulnerable populations in Southern Utah. We'd love to partner with folks. We're just going to get started up here, but it's going to be run through the Utah Center for Rural Health out of SUU. And so if you have any questions, you can, I'll throw my email in the chat box, but yeah, it's going to be focused on social determinants of health and health equity. It's not going to be providing any clinical services, but more help with screening and connecting individuals that are in need of health and healthcare services with resources out there. So, but thanks again for the opportunity. So.
Thank you, Mark. Yeah, that's something else that our office is kind of helping participate in as well. So we will do our best to forward out as many of these opportunities as we can to the list of everybody that registered for this series, and just continue to work on connecting everybody. And then, yeah, if you're interested in more Echo series specifically, the University of Utah produces a lot of different Echo programs. A lot of them are clinical based, but not all of them. And you can find that. Sarah Day just dropped that in the chat box as well. So I invite all of you to take a look at what the University of Utah offers as well for more of this type of Echo series that are very helpful. But we'll keep everybody on the list in a mailing list when we do other activities like this, so that we can send that out to you. And definitely connect with us if you're looking for any other resources, or if you want to share anything, we're happy to share any information you have as well. Austin, you want to advance to the last slide? The survey, we can repost that again in the chat box if you missed that. But go to the next one, Austin, that's got our survey links or our contact info. So we're gonna just kind of stay here. If you've got any questions or you want to chat at all, Austin and I will stay on the call until everybody's filtered out. Please take a minute to do the survey and then grab our contact information. We're happy to connect with any of you one-on-one. But like I said, anything that you're doing, that's any programs that you have, resources that you have, that you want to get out to rural Utah, please reach out to us. We're happy to forward that out through our Rural Health Association of Utah, and then make sure that it gets reported on our database as well. That database is free and available to the entire state. So we'd love to get as much listed as possible on there.